I have known Dr. Moser for about 35 years now. We started out together in the Kansas Academy of Family Physicians, and that's where I first met him as the representative from his district for Tribune, Kansas. He provided emergency services, hospital services, outpatient services, and obstetrical services.
This man has lived the life of a rural individual, not just a doctor, a rural individual. And so he understands from the ground up the problems and disparities that occur in rural life.
He really understands where they're coming from in terms of managing patients in the clinic, in the hospital, being a resource to the local community.
The governor appointed him as Secretary of Health and Environment. He helped to privatize Kansas Medicaid, which has shown to be a cost saver, but also to increase access to care. Subsequently, they looked at access time to care for heart attack and stroke in rural Kansas.
We saw that there were higher mortality rates for rural Kansans if you had a heart attack or stroke, higher readmission rates. The Kansas Heart and Stroke Collaborative, which is now known as the CARE Collaborative that the University of Kansas Health System helped start back in 2014, is basically taking out evidence-based guidelines and working with our rural providers and health systems to put those into the local realities.
But of course people were wondering, why is the academic medical center now coming out across the state? And Dr. Moser was really able to build that bridge because he had trusting relationships with so many of the providers all across the state. And today we have 81 members across 72 Kansas counties, roughly 2/3 of the state of Kansas.
He wasn't done yet. The chancellor asked him to lead up a committee to really look into rural medical education.
My goal was, how could we produce more physicians looking to do primary care and to do that practice in a rural setting? Why not have a 4-year branch campus in Wichita and a 4-year branch campus in Salina? The School of Medicine took on that proposal.
Highly successful. It's in its 13th year. The graduates are about 3/4 of them are in rural practices, so it's really served its purpose.
What is the legacy of Bob Moser for rural Kansas? As things play out, I think will have founded the future of rural medicine for the next century here in Kansas.
He really has built an infrastructure that will continue for decades.
I think Kansans should really take a look in those rural communities, and they'll see folks that are truly dedicated to the mission of providing good care and support for better health in our rural communities. I think it's amazing work that is being accomplished and needs to be respected.